It's lovely to see you again. So, today I believe you are in for a scalp treatment and a head lice check, is that right? Okay, yeah, sure. So, what I'm going to do is I'm going to look through your hair. I'm going to see if we can find any evidence of any of those little terrors. And I will give you a treatment if you need it to help the quality of your hair, to give them a little bit of a shooing away. Hopefully we can get them to leave you alone. But it would be really good if we can just have a little look to start with, and I'll take some of your details, okay? Right, so I think I have most of your details on file. Can you remind me of your first line of your address? And have you had any nits or head lice before? Have you had any treatments before? Okay, yeah, sure. Okay, yep, no worries. It's so easy for them to pass from person to person, especially if you've got children and they're running around playing with each other's hair. It's could be a real pain in the bottom. Yes, of course, no worries. Is there anything you are allergic to? Okay, yep, this shouldn't contain any of that. Yeah, no worries. But I will do just a little test in the corner just to see if there's any immediate reaction if you do need a treatment today. Is that alright with you? Lovely. Do you have any other questions at the moment? Okay, well, feel free at any time to ask me anything you want, okay? No worries. I'm going to start having a little look through your hair and see if I can find anything. Just going to put an apron on, just for hygiene and in case of using treatments, just to keep everything fresh. How have you been since I last saw you? Yeah? Oh, that's good. I know, things have been a little bit difficult recently, but it's really good that I can see you again. Your hair, just from looking at it, looks in very good condition. Do you use any specific products at all? Okay, yeah. Right, I'm just going to put my gloves on if that's alright. Lovely, okay. Right, I'm just going to have a little look through your hair if that's okay. I'm just going to see also if there are any dry patches in your hair that might need further treatment. And what I'll do is I'll go through with a fine comb to see if we can see any evidence of head lice there. But if you do have them, they're not a problem. They actually really like clean hair rather than dirty hair, so don't ever think that because you've got nits, it's because you're not washing. It's not to do with that. They actually really like clean hair, and your hair is beautiful, so that wouldn't surprise me. I'm just going to start running a comb through your hair. Just to see if we can find anything. about here on your hair, you've got sort of a little bit of an oily patch. It could be a little bit of residue left from conditioner perhaps, or shampoo. Just going to part your hair a little bit because it'll be a little bit easier. Let's see. I'm just going to get you to turn your head a little bit for me, okay? Look through here. Oh, that's better. I can see much better now. I do actually see a few little flakes, so I think you might have a little bit of dandruff, possibly. A little bit. Yeah, so I would just suggest finding a really good dandruff shampoo. That's probably the answer for that. Right, I'm just going to give it a little bit more of a comb. Just going to get you to turn your head again. Okay, thank you. So when we're looking for nits, we're looking out to see whether any of their eggs are there, and they look like little gold specks, and that's where they've laid their eggs. So the treatment, if we're going to use any, what it will do, it'll kill the eggs. Let's have a look here, because I have a feeling I saw something. Yeah, I think you do have some. I don't think they're particularly bad. Just turn your head again for me. Let's have a look. Sometimes they like to hide at the back here. Let's see. Yes, you do. You're right. Thank you for getting in contact. You do have a little outbreak of head lice. They're not that bad, but it's better to get them under control before it gets out of hand. So what I'm going to do is just have a little look. If you could turn your head this way for me. Let's have a look around the other side. Okay. So, I'm just going to have a little look at the front for you, okay? They don't normally hide right at the front, but I just wanted to see the quality of your hair, to see whether your scalp needs any more treatment there. So it could do with a little bit of treatment. You have some oily patches, a few little dry patches, so I'll have a closer look and see what we can do. Turn your head, thank you. That's it, like Little bit of flaky skin there. A little bit there. Yeah, a little bit flaky, but it's not much of a problem. Alright, okay, I'm going to start with the treatment now. So, just going to have a little bit of a closer look at the areas that I want to make sure that we don't miss the areas which have got the biggest density of eggs. I did see like 1 or 2 lice, but it's the eggs that will hatch and cause you greater problems. So I'm just going to have a little look with my light and see if I can have a closer look in there. Okay, turn your head a little bit. That's it, well done. Very good. Okay, I'm just going to get to the scalp here. Yeah, it's mostly here at the back of your head. Okay, and turn your head a little bit more for me. Thank you. That's it, well done. That's it, very good. Okay. Lovely, that's good. Right. Very good, okay. What I'm going to use is I have some CBD head lice treatment, which it proves to be very effective and also can cause a very lovely calming effect. So CBD has got natural hemp extract in it, which can be very good for the condition of your scalp. But it also, this little bottle here of this treatment, it destroys the head lice. It should take immediate effect once it's applied on the areas. So we will see and make sure we can get all the areas, and then I'll give it a good brush in to make sure it's covered all the area. Okay, so what I'm going to do is just part the hair a little bit. Just going to make it a little bit clearer. See where we're going to put it. So we put a little bit here. You feel that's a little bit itchy? Yes. Yeah. Okay. So going to do this around spots around your head and just see how it goes. just turn your head a little bit for me. That's good. Yeah. Now I think behind your left ear there's a little patch. So let's have a look. Let's have a look there. Yes, I think so. If you see just here is a little bit. There are a few little eggs in there, so let's get treating that bit. Going to use a slightly different technique. I've got some of it on here. I'm just going to wipe it on your hair, okay? Put a little bit. See if we can rub it in that way. Trying to get right behind your ear because they like to hide there. I'm just going to work my way around, find different areas. Let's just give that little brush in there just to make sure it's all really deeply. Just trying to upset the lice a little bit. And what I need to do as well is just comb it through and have a little look on there. Yeah, I can see them. It's helping them to start to drop off. Did you say you had children? Yes. It might be worthwhile seeing if they could get checked out as well. Does the school nurse come round at all? Okay, so it's coming up soon. So at the beginning of next term. Ah, that's good. Okay, I'm just going to get a little bit more of the product. I'm just going to get a little cloth just to rub it in a little bit. you're doing very well. I know it's very tedious, isn't it? Very good, very good. Now let's grab that comb and see if we can grab any little mites. I call them little mites, but they're lice really. Isn't it strange how we describe things that are small and slightly annoying as mites? There we go, we're looking good there. They're definitely coming through, so well done for being so patient. Okay, it's looking good. I'm just going to keep working my way around. Now this is a stay-in treatment. If you could refrain from washing your hair, I know it may make it look a little bit more greasy than normal. If you could refrain from washing your hair for about 12 hours, I know some people would find that very difficult. Maybe wear a hat or a scarf or some very fashionable piece of headwear just for the day if you have to, because then at least it gives it lots of time to work and for the little bugs to hopefully it'll drop out. And then after 12 hours you give your hair a thorough wash with any normal shampoo, give it a very good lather, and if you like, use a comb, like a fine tooth comb, and just brush through your hair with the shampoo or with the conditioner. It's probably a good idea. And then hopefully any remaining ones will come out your hair at that point, and it will just help remove the debris really. Yes. Okay, just turn your head for me. There we go. Right. Doing very well here. Almost done. I've noticed you have a couple of blonde hairs. I wonder where they've come from. You have a couple of little blonde hairs just in the midst of your lovely brown. That's very unusual. No, they're not great. They definitely look blonde to me. Okay. Got a couple of other areas left to do, so let's get to it. You only need a very small amount of this. If we put too much in, your hair will become too greasy, and the use of the extra product's not going to make any difference to the head lice anyway, so. Very warm recently actually. My hands are getting quite warm in my gloves. Do you have anyone else in your family who's had a bit of itching in their scalp recently? Yes, might be worth getting your partner checked out as well. I mean, I can give you a bottle of the treatment to take home with you today. It does cost a little bit, but not cheaper than you'd get from the shop anyway. If you want to take some with you, and like I've been doing, if you just want to do little sort of spot-on treatments as to the worst areas, I'm sure your partner will greatly enjoy having a sort of bit of a head massage while you're at it. Yes, you can't use too much product. It's not harmful. It's just more wasteful than anything, really. Just going to turn your head a little. Well done. Perfect. That's good. We're almost there now. Okay, just turn to me. Well done. That's very good. Now, I don't know if I mentioned with this treatment that's going into your hair, it does have a natural moisturising effect. So the areas of your scalp where you have some dryness, it will also help that too. So as I've been going through, I've been making sure I've been working on those areas just to make sure they are covered, and that will give natural moisturisation with the use of the product. Just going to put a little bit here, and then I think we might be done. Now these make the application so much easier. Okay. Get there just above your ear. Okay. Let's have a little comb through. Okay, turn your head to me a little. Very good. Lovely. Brilliant. Okay. Very good. Right, now I'm just going to give a little comb all the way through your hair, just to check we haven't missed any spots at all. Okay. Yeah, the front's fine. I can't see any at the front. Okay, if you turn your head the other way for me. Oh, that's very good. Let's just have a look at the base of your head. Yeah. Okay. Lovely. It's looking really good, really good. Well, thank you very much for coming to see me today. If you have any further problems, please do feel to come back and I will give you some further treatment if you need to. Or if those dry patches are not sorting themselves out, it might be worth coming to see me. And then I can do a more topical treatment on those, which might require something more intensive, perhaps a hair mask, something like that. But your hair looks wonderful and I hope that you don't have any further problems today. Thank you, and I'll see you again soon. Bye. Thanks for coming.